announce that I think it's especially for first-time freshman students, you guys are supposed to be doing something called Eagle Flight Check, which you've probably got a bunch of email announcements already. So let's remind you guys to do that. It's kind of a self-assessment to see how you're doing in college and maybe help you to find the resources that you need to succeed if you're having trouble or struggling, just a lot of different areas in college, not just academics or the classes. Do you guys have any questions about schedule or anything about the class at this point? Again, if you want to talk to me about your grade, good times today is probably after 2 o'clock. Not tomorrow, but Wednesday before 10 or after 2 on Wednesday would be good. Dominic, do you have a question?
Do you put like the total amount of grades on Blackboard?
No. The only thing I post on Blackboard is just your exams. I keep grades in a different place in an Excel spreadsheet. It is very laborious and extremely user-unfriendly to post grades on Blackboard. It's very easy to make mistakes typing in because you have to deliberately punch slowly or else it misses letters, and it's just very slow to do that. So I don't do that. But I give you back all your quizzes. You also get back your exam scores. So you know how you're doing in class any one time. You can figure out your own percentage very easily, faster than I could actually. The only thing you don't have is your participation points from iClicker. That's going to be 20 points total over the whole semester. It's not going to greatly affect your grade, but it might improve it maybe 1% or so. So if you've been participating at all iClickers, you can probably add about 1% to your grade, and that's a pretty rough estimation of where you're at.
So it's just like a running total of all points?
Pretty much, yes. Yeah, and then just do the percentage, you can divide by that. So far, we've had 140 points, not counting iClicker, because you've had 4 10-point quizzes, and then it's a 100-point exam.
Did you say today your office hours are after 2 o'clock?
I should be around after 2 o'clock. My other class gets done at 1:40 or 1:50, so maybe 1:50 from there. And I'll be here somewhere between until 4 to 5 o'clock today. Maybe as late as 6, just depends on how things go. But if you're not sure, remember that I posted my schedule on Blackboard as well. So there's a big grid-like form where it's posted on the outside of my door, and you can kind of see when I'm there. You don't have to come just during my office hours. Anytime I'm generally not in class, I'm typically available in my office. Anything else? Okay. Let's see here. Let's kind of catch up to where we're at here. We're going back to chapter 1 for a few minutes. So this is where the anatomical terminology, if you remember the PowerPoint from the very first of the semester, we did a little bit of it covered in chapter 1. This is some parts of chapter 1 also that we're going to cover here in the second exam. So you'll see halfway through this PowerPoint, this particular slide come up. From here on out is what's fair game for exam number 2. We're going to start out a little bit about anatomical terminology, and my first thing to point out is that a lot of anatomical terms actually mean something. We're going to be getting into a lot of names, particularly when we get to bones and parts of bones later on. It could be very difficult maybe to memorize or learn all these different names. Most of them actually mean something. Most of them have Greek or Latin roots, and that helps you maybe know where they're at. You have a Greek-Latin root dictionary in the back of your textbook. There's also some available online, or one that I bought. This is a lifesaver when I started teaching here, actually. It's just a little Greek-Latin dictionary roots, a little bit more comprehensive than anything I found online. I think I picked this one up for like $2 on eBay, or I used both on Amazon. But anyway, that's going to be particularly helpful. Just to point out just a few of these. These are not necessarily lists of things that you need to know. I'm not going to test you on these directly. It just makes it a lot easier to do well in the class. For example, brachium is the root for arm. In the arm, there's a muscle called the biceps brachii. There's a muscle called the brachialis. There's an artery called the brachial artery. There's a nerve called the brachial nerve. All of that refers to arm, for example. Or the armpit is called the axillary area. There's an axillary artery right here. There's an axillary nerve right in this area. All of these tend to mean something. Now, I do point out there are some anatomical terms that actually may have more than one root, because most of these either have a Greek or Latin root, but some things may have both a Greek and Latin roots. Occasionally you see more than one thing. For example, chin. Chin is called the mentum. And there's a couple of holes in the chin called mental foramina, for example. Foramen is a hole. That would be on the chin. The Greek for chin is genio. And so there's a muscle that runs between the tongue to the chin, and it's called the genioglossus muscle. Genio for chin, glossus for tongue. The muscle literally that runs from tongue to the chin. So just pointing out there are some different terms there.
So we're not gonna have nothing.
I am not going to test you on these directly, no. Now, learning these will make learning everything else, the muscles and bones, a whole lot easier, but I am not, this is not a list of things I'm going to, what does buccum mean, or what does plantar mean, or one of these. I'm not going to ask you that directly. Right. A lot of this you'll pick up on your own as you're studying. Some things you do absolutely need to know are these four terms as they're used here. Medical practitioners, anatomists have a language all their own, and to be able to converse in any different foreign country, you're going to have to learn a little bit of the language. And kind of the same thing here for anatomy, for medical terminology. We've got to learn some of these terms. And these are some specific terms we use for the upper and lower appendages. And so we don't use arm for the entire upper appendage. We refer to arm just the area from the shoulder to the elbow, and the area from the elbow to the wrist we call forearm. And so we're looking at muscles a little bit later on. When we talk about flexing and extending the arm, this would be flex arm, and this is extending arm. If I'm doing this, I'm not moving the arm at all. My arm is absolutely still. What I'm doing is I'm flexing or extending the forearm. Likewise, we have thighs, the area between the hip and the knee. And leg, we can find the area from the knee to the ankle. So later on, if I ask you for a bone in the leg, you cannot say femur up here, but you could say tibia or fibula. Or if I ask you for a muscle that moves the leg, you're looking for a muscle that does something like this, not something that does something like this. We have to distinguish between these different parts some way, and that's how we use these terms. And I'll come back to this idea of thigh and leg and forearm and arm, particularly when we get to the bones and the muscles a little bit later on. Definitely be familiar with those, though. Okay, some anatomical direction terms that we use. We're going to start out thinking about superior versus inferior. Most of these are in paired contrasting terms. Superior means up, toward the head. Inferior means down, toward the feet. And this is all relative. Your nose is superior to your mouth. Your nose is inferior to your eyes. It's below the eyes. So a particular part is not absolutely superior or inferior. It's relative to something else. Superior means up, inferior means down. Anterior versus posterior. Now, by the way, this is in humans. The directionality in animals is a little bit different because they're quadrupeds and we're bipedal. So if you learn something on cats or fetal pigs, in a high school course, it might be a little different for some of these. But anyway, for humans, anterior is belly side, toward the front. Posterior is back side. So anterior toward the front. Belly is anterior, back is posterior. In humans, ventral is absolutely equivalent to anterior. It's the same. And dorsal is equivalent to posterior. For historical naming reasons, some particular parts were named in dorsal ventral system, some were named in posterior anterior system, and the reasons for that is probably long, it depends on each individual thing, but those are equivalent terms. By the way, you see this person here standing in what's called anatomical position. So you might be thinking about, well, what's anterior, what's posterior? Maybe it depends on how a person is oriented, how their arms are twisted or rolled. We always assume anatomical position is just as this person is shown here. They're standing upright, toes pointing forward, and the palms pointing forward. You know, that means this side of the forearm is always anterior, this side is always posterior. Or this side of the arm is anterior, posterior, and so on. Okay, so we've got the top three pairs done. Medial versus lateral. Medial means toward the midline of the body. Right down the midline, toward the midline of the body. Lateral means to the side. Think about anatomical position, not an eye clicker question here, but think about anatomical position. Which is more medial, thumb or little finger? Little finger, okay. Think here more toward the midline, little finger is more medial. This is the medial surface. This would be a lateral surface over here. Proximal versus distal. We often use this for appendages. Either the lower appendage, the upper appendage, arm, leg, forearm, whatever. Proximal means near the point of attachment. Distal means away from the point of attachment. So proximal is near the point of attachment. What do you think your elbow would be, proximal or distal? How would you know yet? I haven't given you any reference thing. Okay. How is your elbow in relationship to your wrist? You'd say your elbow is, how does it compare to wrist?
Distal.
It's proximal, right. It might be distal compared to the arm region, the brachium region. But it's proximal compared to the wrist. Everybody get this, how these things have to be defined in a relative kind of position, relative to other structures? Yes?
So what did you say about distal?
Distal is away from the point of attachment. So we think about our upper appendage, most proximal would be the shoulder area, armpit area. Most distal would be the tips of the digits, the fingers. And usually we confine this to upper and lower appendages, but there's a few cases it might be a little bit different. Superficial and deep. These refer to layers, and the names here are fairly self-explanatory. Superficial is on the surface, and deep is beneath. For example, I think many of you guys know that you have a couple layers in your skin. The epidermis on the outside, and then the dermis below that. Epidermis would be superficial. Dermis, which is underneath that, would be deep. We'll learn more about the skin in just a few minutes here, if you're not familiar with that. Parietal versus visceral. I'm going to define this a bit better later on down a couple slides here. But parietal in general refers to the outer body wall. When you think about the trunk of the body, parietal means toward the outer body wall, like toward the musculature or the ribs or the connective tissues, making up the trunk. Visceral would be referring to the inner organs. Liver, heart, lungs, small intestine, stomach. I guess what we call visceral organs. Organs of circulation, respiration, digestion, reproduction, and so on. And more about that when we get later on down the line. I know I haven't defined that one real well, but we'll come to that later. Intermediate just means in between things. All of your fingers have 3 bones to them, and we might call one of them a distal bone on the end, we might call one of them a proximal bone at the base, and the one in the middle we either call middle or intermediate. So intermediate just means in between something else, and we'll see this a little bit later on a couple things. Questions? And often these appear as parts of names of various muscles or parts of it. You may have medial condyle versus lateral condyle on a bone. Okay, planes. These are planes of division. We can think about this for dividing the body in certain directions. They're often, again, parts of other anatomical terms. Their names may appear in that. And of course, the various sections that you see in your textbook when looking through different areas. Sagittal section is any section that runs this way, dividing the body into left and right pieces. So it's a plane that runs this way in the body. That's a sagittal plane. If it's exactly down the midline, dead right down the midline, so it divides the body in exactly equal and right sides, we call it mid-sagittal. Mid-sagittal is exactly right in the middle. It's a sagittal plane right in the middle. One that's off to the side, say maybe one that would go through my right kidney and right pectoral area or shoulder area. If it's to the side, we call it parasagittal. Para means next to the side of. Okay, in humans, frontal planes go this way. How would you say they divide the body into what kind of pieces?
Front and back.
Front and back, if we use anatomical terms, what could we use?
Anterior and posterior.
Exactly, anterior and posterior. Divides the body into anterior, posterior sections, or dorsal ventral. And they run this way. We don't see as many frontal sections in your textbook, but you do see a lot of them when you get to the brain. The brain has a lot of frontal sections in it, but we do see a few of them scattered throughout the text. We see a lot of transverse sections in the book, and transverse sections run this way. Separate the body into what kind of pieces?
Top and bottom.
Top and bottom, or if we use anatomical terms, we might use superior and inferior. Yes, superior and inferior pieces, right. So when you see these, you'll often see something that says superior view of this, or inferior view of this, because that's what you're looking at a superior view of a section, or an inferior view, I guess, depending on the preference. Final one is oblique, and oblique means angled. Any angled section, any angled direction is oblique, and we don't see very many sections of those. We do see a few, but not very many. However, oblique commonly occurs in various part descriptions. For example, you've got a number of muscles in your abdominal areas, a bunch of layers of muscles. In one of them, the fibers run this way, and we call it the external oblique muscle because the fibers all run at an angle. There's another one of them that runs this way. It's called the transversus muscle, or transversus abdominis muscle. And it's because all the fibers run in a transverse direction. So again, if you know some of these terms, it helps learning the other structures that much easier. Okay, looks like our first clicker question today. Let's see if we can make a choice here. Don't have a whole lot of clicker questions today. Got 2 or 3 or 4, but just a little bit longer to kind of dig your high clickers out and get them turned on and make sure that they're working and everything. So you've got a number of choices here. Might be a couple of choices that might work, but among the list here, let's see. And you guys picked on this. What did you pick mostly? Mostly picked E, and proximal is correct. Superior also would not be a bad choice here, although we typically use distal proximal more with the appendages than we do superior inferior. But superior would be another good choice. Oh, looks like some more clicker questions. Let's start with the top one right here. So we've got a number of brain sections. Let's just do the top one. So now our question is, what is this top one? Are you looking at A, a frontal section, B, a sagittal section, or C, a transverse section? There's actually all 3 of those depicted here. Let's see what the top one is. Let's see if you have mastered some of the anatomical terms. It's okay to go back and look at your notes at this point if you need to. And let's see what you're looking at there. So this particular view, you guys have determined is you said mostly B. B is sagittal, very good. That is a sagittal section. In fact, it's right down the midline, so it's a mid-sagittal one. Let's try the next one down here. So, okay, I don't see. I think it should be working. Can you vote? Is it letting you vote? Okay, no one's telling me problems, so apparently the thing just disappeared again. But anyway, it seems to do it about every other time. So now we're looking at this section right here. What is it? We know it's not sagittal. We've already eliminated that, so you got a 50% chance just randomly. Frontal or transverse, which one is this one right here? And looks like you picked anyway here. You picked, okay, pretty good. I was hoping for 100% there, but that is a frontal section. Maybe you're not quite familiar with brain anatomy yet, that may be the issue, but it's a section basically going through the head, through the brain this way. And of course that leaves the last one then has to be a transverse section down here. That would be a slice going this way through the brain. Yeah, we see a lot of different brain slices, a lot of different sections when we get to that. That's the last thing that we do. We get that about Thanksgiving break, just after Thanksgiving breaks when we get to brain. Last thing we do in the course. Let's talk about body cavities just for a little bit. And we're going to focus on the major body cavity in the trunk here that's shown in blue and green. We'll not worry about the dorsal cavity where the brain and the vertebral spinal cord is at. But let's do the other one where the blue and green is. And more or less what we have is the trunk has cavities in it, cavities that have a little bit of fluid in them, and they're divided into thoracic versus something called the abdominopelvic. These are separated by a muscular organ. Anybody happen to know what this muscular organ might be called? Diaphragm. Oh, very good. Yeah, you guys are already up on that. So the diaphragm is a muscular organ, and it's the division between thoracic and abdominal pelvic cavities. Thoracic shown in blue there, abdominal pelvic shown in green. The thoracic has two subdivisions that I would like you to know. It's not shown on the screen, but I'd like you to know these. It has 3 sealed cavities in it. It has 2 pleural cavities. Each one of them contains a lung, and they're individual sealed cavities. If you break that seal, you get a punctured lung, basically. That story will come up more when you get up to the respiratory system in semester 2. But this is the pleural cavities, each one containing a lung, so you should have lung written down by pleural cavities. And the pericardial cavity contains, obviously, then the heart. Yes, so heart would go in there. The abdominal pelvic cavity contains a number of digestive, reproductive, urinary organs, things like the liver, small intestine, urinary bladder, ovaries, various structures like that. Sometimes this is divided into the abdominal versus the pelvic cavities. These are not separated by a band of tissue. So these are just kind of areas. They're not sharply defined by a band of tissue. Instead, the pelvic cavity is basically what would be enclosed by the pelvis. And then the abdominal would be above that. But again, there's no band of tissue that actually absolutely isolates those. These are lined, this whole thing here is lined with a membrane called the peritoneum. And the alternate name for this is peritoneal cavity. Peritoneal cavity would be equivalent to abdominal pelvic cavity. Maybe you've heard that before. Questions? All of these cavities are lined by membranes called serous membranes. Serous membranes line an enclosed space, a space that does not have a direct opening to the outside. These serous membranes secrete a slippery fluid, kind of oily-like or maybe like mineral oil sort of consistency. And they have different names. So let's think of let's try to imagine something just for a moment. I'm going to draw in here, symbolic here, this is going to be the heart. So I've got the heart right here, and it's going to be in a cavity. It's going to be in a pericardial cavity. It is lined by membranes. Okay, we'll make one membrane, maybe right in here, on the heart itself. It's one kind of pericardial membrane. And another one we'll make right in here. So we've got an outer one on the outer wall there, and an inner one on the heart itself. Which one of those, now we can use the words here, parietal and visceral, to describe these. Which one do you think is going to be on the heart itself, parietal or visceral? Not an eye clicker question, it's just, that's visceral, yes. So up here is visceral pericardium. And this one is parietal pericardium. And likewise, we can think of these for pleural membranes, or peritoneal membranes. They're going to have parietal and visceral versions of those as well. And so what happens is this pericardial cavity now has kind of a slippery fluid in there. And that allows, when the heart is beating, these surfaces can rub up against one another without friction, without inflammation, without any problem. There's not a lot of fluid in here, just a couple of tablespoons. It's very thin. There's not a lot of it in there. It's a thin space, but it is there. There is a slippery fluid. If the fluid production is problematic, or you get inflammation, you get various names for these kind of disorders. It's called pericarditis if you get inflammation of this lining here, or if it's in the lungs, we call inflammation of those pleural membranes, we call that pleurisy, or peritonitis for what's inside the peritoneal cavity, abdominal pelvic cavity. And we can kind of see this here. I think we've already been over this. This is not an eye clicker question, but see if you can see which one should be this top one. This describes the membranes in the pleural cavities, and they are called pleura, the actual membranes. So one of them lines the outside cavity, one of them lines the lungs itself. What do you think should go in this top blank? Not a clicker question. That's parietal, yeah. If you can see it, its arrow's pointing to the outside edge. This arrow's pointing to the inner edge. That's parietal. This is visceral pleura. Okay, good. I think you guys are picking up on that. Don't be surprised if you have a picture like this on your quiz on Friday. I might ask you to label visceral or parietal pleura, or pericardia, or something like that. Huh? Okay. Oh, looks like another clicker question. And we've got a section here. This is a transverse section going through the middle of the body. See if you've got some anatomical direction terms to kind of help you out what's going on here. Maybe you can see some of the different parts. You can see the heart and the lungs in this area, and some other organs as well. What do you think? Is it working? Is it voting there?
Where's the vertebrae?
Yeah, the heart is what to the vertebrae? Here's so vertebral column, there's the vertebra right there. So we're looking at heart and vertebra. This is the heart right there. Here's a vertebra. Okay, let's see what you thought on this one. You guys picked mostly A.